So that's concept of just culture and the hierarchy gradient. Like a soldier cannot go to general and talk to him directly, right? So, but in medicine, when the life is at stake, we need to break this hierarchy gradient. Okay. So you can sit down, please. Huh? So the first important has to be situational awareness. If the patient comes, what is your situational awareness? How do you define situational awareness? Yes. What is situational awareness? Floor mic, please. I thought PGI girl will be speaking. Madam kahan hai? If we can have her attention, they must speak.
Yes.
ये सब मैं PGI से ही हूँ.
You are so beautiful, they are observing you, sir.
Sir?
You are so beautiful, they are observing you, sir.
नहीं. This is not all. I wish I could, but चलो. क्योंकि जब मैं था तो I was looking for that girl, वो कभी नहीं आई नहीं. जिसको मैं प्यार करता था वो मुझे नहीं प्यार किया. That's very sad story. Everybody say this is a tragedy with my life. Everybody say I'm very good looking, well dressed, but जिसको कहना था उसने कभी नहीं कहा. So this is the problem. Everybody say except the one whom I like.
You
Never say. अभी भी I like. ऐसी बात नहीं है. Anyway, maybe I will start liking after the lecture also. So situational awareness क्या होती है? Like a patient MI comes, तो आपका ये नहीं कि we are going to treat MI only. He will arrest also. Keep the CPR board ready. Keep the defibrillator ready. Inform the cardiac lab, cardiac person. So situational awareness is there. Is it starter? So just see. Please play the video. There is some surgery going on. Please, if you don't mind, can you be here? No, the first one. So हमें situation awareness रहना बहुत जरूरी है. What is going on? What has happened? What can happen? So the first video, just look at the vitals if you can. There's some surgery is going on. He is an anesthetist, but he's much more interested in learning laparoscopy than monitoring his vitals. (126) saturation. So what's happening here? No. Okay. What the doctor is doing? He is napping. He is learning laparoscopy. So suddenly he found that he need to learn laparoscopy. So like he is not situationally aware. He need to concentrate on his patient, maintain the saturation, the blood pressure, whatever is expected from him. So he has given whatever anesthesia has given. After that, he is not looking even at the monitor. So now this is the problem in India. We are not situationally aware. Patient is having some kind of surgery. He can have a cardiac arrest also. Who knows? He can have an arrhythmia also. So this is like situation awareness, lack of situation awareness. The second one, please the second video. Now this is a combative patient after ETOH intoxication.
एक मिनट अरे नस चल रही है. अरे भाई साहब एक मिनट जाओ. अरे जाओ नस चल रही है भाई.
5386. What is the situation awareness? Anybody? He is RTA with ETOH intoxication, combative. Why going to be combative? क्या करेंगे आप इसको? You will oxygen started, but he is not tolerating. See, he is combative. You will sedate, absolutely fantastic. Then what is your situational awareness after sedation? CPR? No, you must think the worst first. That's the emergency medical. Worst first, but not that worst. Yes. No. You go for airway management like jaw thrust. Because you are going to sedate him, what will happen? All muscle will be paralyzed. So what will happen? How pressure will increase. So somebody should be there at the head end. So that's what the boy is there. Ye wala slide. Next one. So whenever you sedate a patient, become situationally aware that you will have to take care of his airway. So airway means jaw thrust, BVM, iGel, intubation, whatever. But you need to be situationally aware. Yes, I'm going to sedate this patient. Now his airway will go and I will have to be careful. Ask somebody, yes, be there. So this is what he did. Okay. Now, next slide, next video. This is the patient. Look carefully. Okay. These are all our my hospital cases.
हाथ दिख रहा है हाथ दिख रहा है
So did you notice that girl? हार्ट दिख रहा है ना? सर को बुलाओ. So she situation aware. She knows those who are there will not be able to handle this patient. So they called me, and ultimately we treated him. With an open chest injury, heart and lungs coming, lying on the almost over the chest. The next one. बताओ.
ठीक है सर.
Same patient.
ठीक है सर.
क्या कमजोरी लग रहा है?
थोड़ा और कमजोरी लग रहा है बाकी
So
से टाका लगा है. थोड़ा ब्याज होगा लग
बंद
रहा
कर दो.
है. सांस.
So because they were situationally aware and they immediately called for help. That's what Dr. Silva are saying. They immediately call for help. If that is not required, okay, at least you have called, right? So they were situationally aware. They knew that this patient is very sick and something needs to be done and senior person needs to be involved. So we could save this patient. So situation aware is the cornerstone. What has happened with the patient, what's happening, what might happen. You have heard ना? वो सर पेशेंट आया वो तो अरेस्ट ही कर गया. अरे पेशेंट तो अरेस्ट ही करेगा, वो आया ही अरेस्ट करने के लिए. You need to be research ready all the time. There is no excuse. Research ready. That's why 0-point survey. Whether you know or not the scale, but you need to be research ready all the time. This is emergency medicine. This is the emergency mindset. We in our hospital all the time we are research ready. We'll show the video. Next slide. Now, what is your plan B? You must have a plan B in place whenever you are dealing in emergency department. So in UK in 2005, this is Ellen Bromley. Please play the first video. Wife of a pilot, Martin Bromley. Please observe what's happening here.
and I have a straight line straight yeah what need you to do some pressure
Observe what's happening here. I'll ask question. But feel psychological safe. No assessment.
okay
So what was happening there? Anybody can summarize? She went for a sinus surgery, simple sinus surgery. They were trying to intubate. Somebody has noticed OHA that could not intubate. Then somebody brought the bronchoscope, could not intubate. Then ultimately she had a rest and she died next morning. And her husband is Martin Bromley, he's a pilot. Now he teaches human factor to doctors. So the point is that they were fixated. Intubation. Nobody thought of surgical crime or tracheostomy. So you must have a plan B. So they were not having their plan B. This is why this patient died. Somebody must prompt them. नर्स भी बोल सकते कि सर प्लीज अब ये कर दो. Sometimes my nurse say सर ऐसे तो करते पहले आप ऐसे करते थे. Okay, I will eat 5 minutes of the next speaker. I'm so next video. So this is my plan B. If I'm not able to intubate, this is a patient with down airway with severe maxillofacial surgery. I mean trauma. So I had to do what I'm doing here. Anybody? It's not tracheostomy. ऊपर देखो ऐसा ट्रेको से ऊपर है. This is किनको देखो ट्रेकोस्टमी नीचे होती है. PGI girls. किनको thyroid में. So I did that. चलो next. Now, okay, Alan Bromley. Okay, so this is the same patient. Okay, he was saved. Next slide. Now, threat versus challenge. If a very sick patient comes, how do you decide that you take it as a threat or you take it as a challenge? That's very important. If we feel threatened, we will lose the patient. But how do you decide? How do you behave? What are the factors which tell that you are taking it as a challenge or as a threat? So beat the stressful, like breathing exercise. The important thing is your exhalation has to be more than your inhalation. Right? That is the like you do triangular breathing, you do box breathing or diagonal breathing, anybody. But important thing is, play the first video please. This is a patient of cardiac arrest. In India, patient will come unannounced. They will just crash in, right? They will not say EMS report. They will just crash in. So, have you encountered this situation in your practice? So, this is like, what do you think? What's your impression? He's feeling threatened or he's taking it as a challenge? Challenge. Okay. Next video. Are you noticing CPR? Then because we expected a prolonged prolonged CPR, that's why we are intubating. Otherwise, LMA is okay, right? So we are using video laryngoscope. Are you seeing the glottic opening? And what is this? Are you using this manometer? ET cuff? Don't waste time looking for the syringes in sick patients. And then EtCO2. Using this also, EtCO2. This is very important in cardiac arrest. Without this, in America, it will not be possible to do a high quality resuscitation. Because it's CO2 which will tell you so many things. Like if it is continuously around 10 or 15, that means your chest compression not good. If it is around 20, that's acceptable. And it suddenly goes to 40, that means maybe you are going to achieve ROSC. So CO2 is very variable. That's what we use in our setup, right? Next video. Now cognitive biases. So this is a patient fall from height, multiple injuries, and this is the video I showed to the doctor. I had to took him to the corporate hospital. Please start the first video. First video. The second one. Can you see the EtCO2 monitor? Second one.
Deepak Kumar.
Fall from height, polytrauma, cardiac. I have done what I am trying to look at this scan. What is there? What is there? Next video will be shown. Have you heard of cardiac tamponade? This is what the patient had. Can you notice the heart and the fluid around the heart? Here. So this was a patient who cardiac tamponade, right? I told the surgeon, I told everybody, but they were biased. Fall from height, let's take care of other stuff. Patient died, he had healthy rupture. Next video. So cognitive biases. So biases are basically cognitive biases like simplifying things which are complex in nature according to our comfort. So we'll read about those. Although there are a lot of books I will recommend. Opportunity for unnecessary failure. This happens in India very frequently. Please, first video, please. So the surgeon is coming, he's still talking on the phone. Anesthetic is there, there is no team huddle, there is no like what they are going to do, what would be the complication, how much time they will take. He's still talking on the phone, and then he went inside, patient of polyarthritis, found adhesions, abandoned the surgery, and then he started complaining to me. So this is the problem. He is giving opportunity for unnecessary failure, and that's what he landed. Second video. That's another fantastic scenario we have. Something goes wrong with the patient, surgeon will go and stand in the corner. He should be contributing to the overall resuscitation. Whatever problem is, this crisis resource management, he should come forward and say, ask, what is, can I help you? Can I do something? But here I have seen, they will just become indifferent. Like we are not related to this patient. Now it is the anesthetics which will take care, and they will stand like this. They are also giving opportunity for unnecessary failure. They should contribute. Next, pre-mortem. Pre-mortem is a very important skill. Like you start some process, like a patient of MI comes, he dies. You just think, so what are the various reasons a patient of chest pain can die apart from MI? Yes, ma'am. Cardiac tamponade, yes. What else? What can chest pain die of? Rib will not cause death. Tamponade, pulmonary embolism, dissection of aorta. Okay. So now we will think all these things. These are the things which has killed the patient. A patient has come, we have scored that he has died. Now next patient comes, then we will consider all those things. So this is a very important speech by Gary Clay, very pre-mortem. Next slide please. Now intuitive thinking, flexible thinking. So first slide please. There is one patient, I could not find any vein, so I had to go for IO. We have designed IO access. We are using very frequently. This is from the very beginning when I started in 2017. This was very primitive instrument, but we saved this patient. So you need to have some kind of intuitive thinking whenever you are dealing with a very sick patient. So we could start the fluid, we could give the platelet as well, right? So I'll ask you, in India, where there is a resource limitation, please have intuitive thinking so that we can use our resources intuitively and judiciously, right? Then the second we can skip. And next slide please. Now dealing with uncertainty, second slide. Play the second video. So this is the patient of chronic cardiac arrest and there was sign of life. So what I am doing here, what procedure I am doing here? They are not BSc, MSc students here. What I am doing, they don't attend sick patients, sick resuscitation. So yeah, what I am doing here? Where phenoceutic retractor is used? Phenoceutic retractor, resuscitation through debaggy clamp. Okay, anyway. What I am doing here? नहीं bleed नहीं. There's something more. ये तो मैं खुद ही bleed कर रहा हूँ. Just look at this. This is resuscitation thoracotomy I am doing. Please play the video. Observe, I'll ask 2-3 questions. No, we will talk about it. Just observe the procedure. Observe the what is going on. That's not done very routinely in India. We must encourage because this is sometimes in penetrating chest trauma will really save life. This is resuscitation thoracotomy I am doing for a cardiac arrest, and you can do open massage as well. Okay, so dealing with uncertainty, like somebody come very, very sick, despite best of your treatment, you cannot save this patient. That doesn't mean that you get into depression, you start questioning your own qualification, your own experience, what is known as imposter syndrome. What is imposter syndrome? Have you ever suffered from imposter syndrome? Like, I'm not good enough. Like Dr. J.S. Chopra and Bhamri always used to say, you are not a good doctor. You should not become a doctor. Is he still there, Dr. Bhamri? Okay. So he always used to tell me, you are not a good doctor. You should not do medicine. So that is not like sometimes we feel, why have you come to this field? I'm not a good to become a good clinician. So you must not suffer from imposter syndrome because you have given your best and you must know how to deal with uncertainty so that next patient will be good. I will take 5 minutes of the next speaker. Okay, next please. Never waste suffering of your patients. Can anybody elaborate on this point? Never waste suffering of your patient.
We should always learn from our mistakes.
Other mistake. Yeah. Who said that? Lord Buddha. Rather than learning from your mistakes, learn from other mistakes. But we must never ever, like this is, please play the video. We do a lot of high stake resuscitation. So this is a cardiac, again traumatic cardiac arrest because we deal with a lot of trauma. So here I am doing, what are the recommendations? If patient of cardiac, stop this video. If a patient of traumatic cardiac arrest and you think there's sign of life, what will you do? First step, you put a probe, look for the cardiac activity, like if there is a feeble cardiac activity, what are the intervention you are going to do? You have to do bilateral finger thoracostomy. Don't look for chest tube. आप अपने डॉक्टर को बताइए. I mean, this lecture is for you. I'm replacing doctor with a nurse. So you can tell your doctor, please go for finger thrombectomy at least. Right? And other stuff, like they must be knowing. But sometimes you can take the lead. Please play the video. And because this is like something slipping out of her hand, so of course aseptic precautions are needed, but in such scenario, so one side, another side, just a blade and a cali and your finger. Okay. So to do the best for our patient, for whatever we have, right? That's what we can do. We cannot infuse or we can give back to life, but we can do best whatever we have. The resources I'm talking about. Because in America, Dr. Einstein, he's there. So there they will start MTP. MTP means they have a trauma pack in ED. And I would request you, sir, Dr. Rao, like we are not giving O positive or negative blood. We are always saying cross match karao. But please start infusing. Don't worry about the medical legal aspect. We will take care of that. You can give O positive, now O positive. Other it was O negative, but you can give O positive also. Start O positive blood without cross match, without anything. Just give the blood. Okay. So these things we need to take care. We need to start, brother. Like we are still going. अभी ब्लड जाएगा, अभी गया है क्रॉस में. No. We need in such patient, when we have these kind of patient, then only they will be, saved. Otherwise, not with our routine approach, what we have in place. Okay, next slide, please. So there are so many things I want to talk about, right? But these are the main things. So to summarize, we must have, apart from our certificate, a solid training base. That means experience from various kind of patients, and that is known as recognition pattern. So this is how you make expert make decision. You just recognize the pattern. This is patient fits into this. That is system one thinking. There are two kinds of thinking, system one and system two. So there are a lot of books you need to read, and I would say we have responsibility because somebody else's life is in our hand. So don't think. You must have that kind of thinking when you are dealing with sick patient, that somebody else's life is in our hand. Whatever possible, even if you have to, use your own personal resources, please do that. We do many times. 80,000 we waive off, 90,000 we waive off. But we do say, we do learn. So if you want to learn, please start recording also, ma'am. Let's not be scared of those, medical legal. They are there. But if we are doing our good job, that's okay. Let's have CCTV recording all the procedure so that we can improvise, so that we can learn from these things. So that's why I could learn whatever I am showing you because something goes wrong, I always play the whole video and find out why, how, because they are simple patients, we have trained you, and that's what you need to do. So with that, one more, please two of you come here. एक तो साइकोलॉजिकल सेफ्टी इनको आप अच्छी तरह से कीजिए. ये बच्चों की तरह बिहेव कर रहे हैं और दिस इज व्हाट वी नीड टू टीच. कोई भी दो नहीं आएगा. सलमान खान रहेगा तो दौड़ के आएंगे. तो वही सलमान खान का मेरे ऊपर लगाओ. देखो सर, देखो उतना मैं स्मार्ट नहीं हूं तो 4 लड़की आ जाती. वो बार में यही हाल ही है. आप बताओ. आ जाओ. वो कहा है.
They will not come